Good morning, everybody, on a beautiful sunshine-filled Monday morning. I was just saying, even when it's this cold, when the sun's out, it makes such a huge difference. But I'm glad for you all, we're not doing this outside somewhere, but still get to enjoy some of that great vitamin D. I want to thank Director Bashadi, the Department of Public Safety Review Committee, firefighters, dispatchers, public safety staff. I am grateful for all their work that they've done to get us to where we are today. We're here to talk about the city's response to medical calls and making sure residents are connected to the right care at the right time. As we look for ways to make the city's resources work even harder for the people of Columbus, we saw an opportunity. What if we could improve patient outcomes and also ensure our emergency medical resources are used when they're needed most? Currently, we are all accustomed to calling 911 because it's a lifeline that makes sure that help is on the way quickly. But I think we all know, and we certainly have a great deal of data to show us, that not every medical call to 911 requires an ambulance. Using emergency resources for non-emergency needs may not be the most appropriate care a patient and may not be the most appropriate use for our medics and equipment. What we want is to build on the concept that helped us create our successful right response unit. The same goal underlies both programs. Get the patient the right response and resources at the right time. That's why our Department of Public Safety is moving forward with a nurse healthcare navigation line designed to work alongside our existing 911 operations. Soon, we'll be presenting Columbus City Council with legislation to allow the Department of Public Safety to offer this service to strengthen our emergency response in public health systems. Should the legislation be approved, and once contracts are signed, this new nurse healthcare navigation line will begin taking calls in about 6 months. So here's a little background. In 2024, our division responded to nearly 145,000 EMS calls. In 65% of those cases, no EMS treatment was actually provided. Only 55% resulted in transport to an emergency department. Let me illustrate the point that in 2024, firefighters responded to 172 calls for toothaches. In most cases, no EMS treatment was necessary. Yet nearly 70% of those patients were transported to emergency rooms, where they were typically referred somewhere else for care. Runs like these increase costs for patients and tie up emergency resources that could be serving others in our community. The Nurse Healthcare Navigation Line allows us to respond more effectively. When someone calls 911 for a medical issue, trained staff will continue to use established medical protocols. But when the situation meets specific criteria, the caller may be transferred to a registered nurse. That RN will assess their needs and help connect them to the most appropriate option. Those options may include primary care or urgent care, telehealth, pharmacy services, behavioral health or substance use support, transportation assistance, or self-care guidance. If the nurse thinks an emergency care is needed, the call will go back for an EMS response. So this is all about helping our neighbors find care that meets their needs. And it could dramatically improve the old system of taking patients to the emergency room on every call, which is the most financially burdensome care. It also helps ensure our ambulances and firefighters are available for life-threatening emergencies when seconds matter most. I don't know about you, but the number one concern I hear from Columbus residents right now is worries about affordability. Affordability of housing, transportation, groceries, and healthcare. This is the one step that we can take to make sure that first and foremost, residents get the emergency health care they need. That won't be compromised. But also, we can help see to it that patients are directed to the right resource when emergency health care clearly isn't required. I think it's important to note that our plans call for triage patients to receive a follow-up call within 24 hours, reinforcing continuity of care and helping prevent repeat calls. I want to thank the review committee, our firefighters, dispatchers, public safety staff, and partners for their leadership and commitment to continuous improvement. And I want to thank our residents for trusting us to keep evolving how we serve them. I want to thank the folks that are with me up here today as well. Dr. Lowe and his team have been incredible in advancing this effort. Councilmember Remy and I have been talking about this for a number of years. He's been an incredible advocate. He'll be carrying this legislation before City Council within the next couple of weeks. And then Steve Stein. I think, Steve, we said that you originally wrote the city about this back in 2023. And so here we are today being able to move forward on this critically important effort where we're going to get folks the right care, the right response, but also, as I was talking with President Stein earlier, make sure we have available resources to do more runs in the city of Columbus by Columbus EMS, who we argue are the best in this community and around the country. So we're excited about what we're going to do together. Next, I'll turn things over to Dr. Lowe.
Well, good morning. As mentioned, I'm Dr. Robert Lowe. I'm the medical director at the Columbus Division of Fire. And having been active in emergency medicine and EMS medicine for some 25 plus years, I can't tell you how excited I am for the city of Columbus to embark on this patient care endeavor. This program is about optimizing care for all of our patients. Getting the right care for the patient's need in the right amount of time is really the overarching goal. Ultimately, as public safety providers, we are working to align the right resources for the patient's needs at the point of the 911 call. We understand emergency medicine care. EMS has a particular skill set in managing time-critical diagnoses and interventions and providing care in very unique situations and settings. But we also realize that other providers and other specialties may be more appropriate in certain medical conditions and certain diagnoses. When we look closer at what it means to put the patient's needs first, we begin to realize it might not be appropriate for some conditions and some diagnoses to be brought to the most expensive healthcare option, especially when that setting may not be optimized for the current treatment and need. Decreasing the financial burden and the time to connect with the correct provider by directing patients to the most appropriate care setting benefits all of our patients within the system. While not the very first city to embrace this approach, we are definitely on the leading edge of care as we develop this partnership. We have seen promising results in other cities, both with patient experience and satisfaction, but with positive health outcomes and with safe dispositions of patients. We look forward to developing this level of care for all of Columbus. And with that, I'd like to welcome Steve Stein, President, Local 67.
Good morning. Thank you to Mayor Ginther, Director Prashadi, Dr. Lowe, and our council member and public safety chair, Emmanuel Remy. Thank you all for bringing us here today and for recognizing the importance of investing in smarter, more resilient emergency response systems for the city of Columbus. Today's announcement regarding nurse triage software is about meeting the realities of modern 911 call volume with thoughtful, evidence-based solutions. Our Columbus firefighters, EMTs, and paramedics are responding to more calls than ever before, and while every call matters, not every call requires an emergency response or transport. Nurse triage gives our dispatch system the ability to safely identify low acuity medical calls and connect those callers with the appropriate clinical guidance while keeping fire and EMS units available for true emergencies where seconds can mean the difference between life and death. For our Columbus firefighters, this is about bandwidth and readiness. When our units are tied up on non-emergent runs, they are unavailable for cardiac arrests, strokes, major trauma, and fires. Using technology to better match resources to need helps protect response times. It improves patient outcomes and strengthens the entire system for the entire community that we serve. I think it's also important to put today's announcement in historical context. Your Columbus firefighters have been at the forefront of nearly every major advancement in EMS in this country. As a matter of fact, the very first cardiac care transport vehicle in the United States, right here in Columbus, Ohio. And more recently, our members in the Division of Fire in the city and Public Safety partnered with a number of local hospital networks to bring the mobile stroke unit to Columbus, which is another innovation that has saved lives by delivering hospital-level care directly to patients in the field. Innovation has always worked best when it's built through collaboration. And the International Association of Firefighters has been a key driver of EMS innovation, and we're happy to be part of this conversation today. So as nurse triage moves from concept to implementation, we really look forward to working closely with the city through not only collective bargaining, but policy consultation to make sure that we deploy this tool in the way that supports both patient care and the professionals providing it. And when the City of Columbus and the Firefighters Union work together, we have a track record of building systems that are stronger, safer, and worthy of the public's trust. We truly appreciate being at the table, and we look forward to continuing that partnership as we progress throughout the year. Thank you, and it is my privilege to turn it over to Columbus City Council member and our Public Safety Chair, Emmanuel Remy.
Good morning. Thank you, Mayor, and thank you, Director Prashadi, Dr. Lowe, and President Stein, our firefighters, dispatch, public safety professionals, and everyone who helped build this program the right way. Across the country, including here in Columbus, Ohio, our emergency medical system was built around a simple assumption. When someone calls 911, the response must always be an ambulance and a trip to the emergency room. But we've learned that not every medical call fits that model, even though every call represents a real need for help. When the system only has one answer, residents can be routed to care that doesn't fit their situation. Families can face higher costs, and our emergency resources can be stretched thinner, resources that must remain available when seconds matter. My guiding principle is straightforward. We should answer every call the right way every single time. That's what this nurse health care navigation line does. It modernizes. And we get to see them in action today. That's what Nurse Health Care Navigation Line does. It modernizes how help is delivered without ever closing the door on emergency care. 911 remains the front door to help. What changes is what happens next. When a call meets clear clinical criteria, trained dispatchers can connect callers with licensed registered nurses who assess needs in real time and guide them to the most appropriate next step. That may be emergency response, or it may be another form of care that is faster, more appropriate, and less burdensome for the patient. And if at any point emergency services are needed, the call is immediately routed back to EMS. This approach also respects our firefighters and paramedics. Highly trained professionals should be focused on the emergencies they are uniquely equipped to handle. By aligning calls with the appropriate level of response, we protect response times, reduce burnout, and strengthen readiness across the system. This is also an affordability and equity issue. Emergency room care is often the most expensive entry point into healthcare, and it's not always the right one. Helping residents reach appropriate care can reduce unnecessary financial strain, improve outcomes, and treat people with dignity. As this moves to City Council, our role is to ensure strong clinical guardrails, transparency, and performance metrics, equitable access across neighborhoods, and clear accountability so this program delivers on its promise. This is what modern city government looks like. Using data, compassion, and collaboration to serve our residents better. I'm proud to champion this effort, and I look forward to continuing the work so every resident gets the right response at the right time every single time. And now I'd like to invite the mayor back up.
Thanks, Councilman. Well, thank you again for being here, and just really want to acknowledge the great work of Director Pasciati and her team, President Stein, Dr. Lowe, and Councilmember Remy. We wouldn't be here without their help, their support, their work. I'll open it up for any questions that you may have on this Nurse Healthcare Navigation Line, but out of respect for everybody's time behind me, if you have questions on other topics, including that dramatic OSU women's basketball come from behind win over the weekend on the road against Maryland, I'll stick around for one-on-ones on that. But any questions about today's subject?
When do you plan on presenting this to council?
Go ahead, Councilmember.
We'll be taking that up after President's Day, so I don't know, 9th, 7th. I think it's the 26th? Yes, correct.
There's nothing like having an emergency, knowing you need medical care, getting that medical care, and then getting whacked with a bill a week later. So have you guys talked to people in the community about this, and what has the response been from the everyday person who lives in all this?
You're absolutely right. This is an affordability issue, an equity issue, making sure we get folks what they need, but not necessarily be part of an archaic system that puts them further in debt, and we know that medical debt is a huge issue for families in this community and communities around the country, which is one of the reasons we think this is so important. But I think Councilmember Remy and President Stein also spoke to our firefighters, our folks that are part of this EMS response. I think it's still about 85% of our runs are for EMS, about 15% for fire. So you think about this, the burnout, the overtime, the frustration probably for some of our EMS professionals that are going on runs that, quite honestly, their skill set, their experience, their training would be a much better use on different calls of a crisis level. But I don't know, President Stein, anything you guys want to add?
No, I would echo the mayor's points entirely, and I think the other thing too, and as Dr. Lowe can kind of speak to our medical protocols, is that we all, of course, want to make sure people are getting the right care that they need, but so often our medics, just based on protocols beyond the city of Columbus, have to take somebody to an emergency department. And while we're more than happy to be a point of care for that person, when they get to that hospital and they get that hospital bill for those other things, I mean, that really compounds the exact problem you were talking about.
And forgive me if you guys have already said this, but will this be 24/7 operations?
Yes, we anticipate standing it up as a 24/7.
Dr. Lowe, while you're up there, can you give some examples of what might be a call that comes in, but isn't appropriate for an EMS to come out and might be more appropriate for a nurse to handle?
Yeah, certainly. So there'll be protocols to sort of tease out if there is an acute medical emergency that requires a time-critical response. But we illustrated toothache because I think it's a common thing to understand that even the transport to the emergency department might not be the right place. I think medication refills fall into that. Very simple types of just exacerbations of ongoing chronic problems and getting you aligned with the provider best equipped to take care of you. As we talked about, our EMS providers have a great skill set, but aligning the needs of the patient with that skill set is the right thing for them, but the right thing for the patient is to align the right provider with the needed skill set.
And I think one of the other benefits here we have incredible healthcare systems in this community. We're blessed with so many wonderful options, but it's the same reason the Adam H. Crisis Center was so important, and our police officers and firefighters are making great use of the Adam H. Crisis Center. People who are in a mental health crisis or are battling substance abuse disorder need treatment. They don't need to be in an emergency room, and they certainly don't belong in jail. And so this is another parallel, as I had talked about, Right Response, the Alternative Crisis Center, is to help make sure our emergency rooms don't get overwhelmed with folks with situations that probably don't belong there. And there are better resources and support for those folks as well. So this isn't just in the interest of the Division of Fire and EMS, but part of our health systems as well.
What will this investment cost the city?
We believe that this will not cost anything out of the general fund, and we believe it will be revenue neutral. Is that correct? I was just looking at the safety director to make sure.
So then what would pay for it if it's not the general fund?
I may have the director have you follow up with her about that. But we think this is, not only will this not impact the general fund, to President Stein and Councilmember and Dr. Lowe's points, it'll help us make more runs over time by Columbus EMS into the city of Columbus. Many of you know about mutual aid, and when we don't have folks available, other departments come into the city on runs. Over time, we think this will help us make sure that more Columbus residents and taxpayers are getting response, if medically necessary, based on this new technology and new system from Columbus EMS. We think over time it'll help with burnout and with overtime. But the specifics on costs, I'll leave to the director.
How does this work? I mean, you get a person that calls 911, they're panicking. How do you try and get the information that you need out of them when they're in a panic state?
Dr. Lowe?
So we already have dispatch protocols in 911 to rapidly take control of that call and assess those needs. And that begins with a series of questions to determine immediately what the life threats are. This program, as we work through that dispatch criteria, would then come online when we reach a point where we've satisfied ourselves that there doesn't seem to be an immediate life threat, immediate need, and we've begun to work through a process where it sounds like your needs might align better with a provider who could provide more appropriate resources, and that's the point where the transfer would happen.
What other cities have stood a program up like this before?
We've talked to a few cities. The most common folks we've talked to is out of both Washington, D.C. and Indianapolis.
Any other questions about nurse navigation line? I'll stick around if you have questions on other things, but I'll let these other folks get back to their jobs. Thanks, everybody. Thank you. Appreciate it.